Good evening. Welcome everyone to this evening's Facebook Live. My name's Jane. I'm one of the nurses here at Breast Cancer Now, and I'm joined by my colleague Sally.
Hi everyone, I'm Sally. I'm one of the nurses at Breast Cancer Now too.
So this evening we're going to be talking about waiting times, and we're going to cover quite a few different aspects of waiting times. It's waiting for treatment is one of the themes that we're going to cover. So waiting for breast cancer treatment to start, waiting for subsequent treatments, but we're also going to be talking a bit about if you're waiting for a referral to a breast clinic, if you're waiting for some biopsy results, what happens when there's delays in treatment waiting times, what can you do, and how to manage that wait, really. Just a reminder that this is an open public place, so anything confidential, you're more than welcome to contact us on our nurse@breastcancernow.org email address or our helpline, which opens tomorrow morning at 9 o'clock, and that's 0808 800 6000. We will be putting in a questionnaire just to gather your thoughts on these Facebook Live sessions. What could we improve? What could we do differently? Any topics that you'd be particularly interested in us covering? Because we want to make it suit you and your needs, and that's what we're here to do, really. So what I'll do is perhaps if we kind of kick off, Sally, right, almost from the beginning of when somebody first goes to their GP and with a breast change, and the GP refers that person to a breast clinic for a further assessment. There's slightly different referral structure currently, isn't there, across the nations? Can you talk a little bit about the 2-week wait and the faster diagnosis standard?
Yeah, so obviously this would, our messaging at Breast Cancer Now is around our TLC messaging, the touch, look, check, and that is about people being kind of breast aware, checking themselves, knowing you're normal, and then recognizing any changes to your breasts. We've got lots of information on our website around that. And it's the checking part is to go to your GP and get that checked out. And that will generally result in a referral to a breast clinic, as you say. And so historically, it's been a kind of 2-week or urgent cancer referral pathway across all of the 4 nations, and that still exists across 3 of the nations. In England, that's slightly different in terms of when you're referred to the GP, there is now a 28-day faster diagnosis standard, which is kind of a bit of a wordy mouthful. But what that means is that a high percentage of everyone that's referred should be seen and either be seen, be assessed, and either determine whether you're potentially the kind of 9 out of 10 people that go to a breast clinic and don't have breast cancer, and you go through that investigation process and get those results, or that for the people that are diagnosed with breast cancer, that diagnosis is determined within that 28-day faster diagnosis standard. So that's that as high a percentage as possible of people are seen, assessed, and know the outcome of their breast assessment within the 28 days. As I said, across the nations, the referral is an urgent referral. So these are symptoms that potentially could be breast cancer. And as I said, that's not always the case when someone gets seen and assessed. And that's about then waiting to be seen in a clinic. And your GP should have some idea, because they're doing referrals all the time, the kind of waits their patients are experiencing. And in some cases, once your referral's been registered, you then get contacted by where you've been referred to, so that you've got some kind of contact later down the line if you haven't heard about an appointment. So that's the kind of referral process.
Yeah, and I think, for anybody that's watching saying, well, I can't even get a GP appointment at the moment, or is having difficulty getting a GP appointment to have a breast change assessed, or with any concerns, we're going to pop a link in the chat, which is about how to get appointments with your GP, the different types of appointments that are available now, and what you can do if you are having difficulty getting an appointment with your at your GP practice. And also with for somebody that's gone for screening, Sally, so that's a symptomatic, somebody's perhaps found a breast lump or another breast change. They've gone to their GP who's referred them in through that route. Somebody who goes for a screening mammogram, so somebody that doesn't have any symptoms, which is obviously the purpose of the screening program, is to pick up changes before a symptom can be felt. So it's at an earlier stage. So if somebody were to go for a breast screening appointment and get recalled and referred, that's a sort of slightly different process, but ends up through in the same assessment clinic.
Yeah, I mean, when you go for your breast screening mammogram, so obviously the breast screening program is women are invited from the age of 50 to 53 up to 71 every 3 years for a breast screening mammogram. And as you say, that is for someone who doesn't have any symptoms, and this is to detect things that can't be felt. When you go for the mammogram, and that can either be in a hospital or sometimes on mobile units, so that it's more accessible in things like supermarket car parks, the radiographer that or the mammographer that does the mammogram should be able to give you an idea of the kind of exact weight their current service has. It's usually a few weeks to get your mammogram result, which will either be a letter saying everything's, there's no evidence of breast cancer on that mammogram, or you may get called back to a breast screening assessment. And sometimes that callback can either be, and they tend to tell you on the letter whether it's a technical callback, so whether the mammogram just needs repeating because the images aren't, optimal, they're not as good as they would want, or whether that's an assessment for any potential abnormality. And again, that doesn't always result in a breast cancer diagnosis, but it is then going to an assessment clinic for a referral. And then, as you say, if any biopsies are taken, the wait for biopsies and then to either see the breast screening team or be referred to a surgical team would be the same as someone that was referred by their GP and had a biopsy, and then they see the surgical team afterwards for the results to kind of make some treatment decisions.
Yeah, and we speak to a lot of people, don't we, on the helpline and through our Ask Our Nurses service, about people that are understandably extremely anxious about that wait. To be recalled for a screening mammogram can be a really frightening time, even though, like you say, the majority of people don't have breast cancer. And if you're referred to the breast clinic, it can be a very sort of scary time as well. So we've got a sort of a range of health information. We've got a booklet and web information about referral to a breast clinic. So you can at least be a bit prepared and know what to expect when you go for that appointment.
And consider taking someone with you if you think you might have any kind of specific questions, or there's a family history that you want to share with the team, or your kind of medications and your history of your symptoms if you've been referred by your GP. Sometimes just jotting those down, or feeling as you say, prepared when you go for that appointment. And generally you'll be seen by either a doctor or an advanced practitioner specialist to be, to have your history taken, to be examined, and then that will really determine what investigations you might need. And that's generally done on the same day in what we call one-stop clinics, and can include, multiple kind of radiological investigations, so mammogram and ultrasound, and also any kind of biopsy. And then you then wait for those biopsy results, which generally can be kind of around that 2-week mark. But it's difficult for us to be completely kind of prescriptive of every kind of clinic across the UK, because there can be some slight variations. But again, it's just about asking, sometimes knowing what kind of time you're going to be waiting to kind of help with that kind of planning and how you're going to manage that wait.
And staff at the breast units, they know how nervous and anxious people are going to be, and usually they're well experienced and well skilled at trying to put people as much as possible as they're at ease, giving them sort of information that they want in a way that they want it. And dealing with that uncertainty, as you say, if you have to wait for biopsy results. And some people sort of can't, because biopsy results, like you say, they can take up to a couple of weeks to become available. And that's a lot of that is to do with sort of the processing of the tissue and what they have to put those tissue samples, the processes they have to put them through to be able to sort of examine them and analyse them and then report on them and then discuss them at the multidisciplinary team meeting. So that it is a lengthy process, but it's kind of a lengthy process for a reason. It's a sort of what happens to the tissue for them to be able to, the pathologist to be able to sort of get a diagnosis.
That's right. Yeah, it's about putting all of that information together and then being able to, as you say, come back to someone with the information they want in a way that they want. And I think that's another thing is, it's just, people will ask different questions, having, in clinical practice, undertaking those clinics, and some people, may want to know as much as possible up to one point, or people may say, actually, I'd rather wait till you've got all the information and then put all of that together. So it really is that these appointments are for you, they're for the person attending, and it's just important that people get the most out of those appointments in terms of being able to ask questions, get information, and hopefully come away with some kind of plan, although as you say, completely acknowledge the uncertainty for people and how challenging that can be.
Yeah, absolutely. And a couple of other things to mention in terms of information on our website. We've got a blog post about, if you've been recalled from a screening mammogram. So you can check that out. I'm not sure I've sent that across, but we can pop that in. And also, if you are waiting for biopsy results, and what a scary time it is, I would encourage people to ring us, talk things through. Obviously, we can't tell you what the results of those biopsies are going to be, but we can talk through sort of ways of managing anxiety and managing that time while you do wait. So do pick up the phone, give us a call, like I say, on the helpline number 0808 800 6000.
We've also got the forum as well, haven't we, where people, who are going through a similar experience kind of share their experiences and how they're coping. And, the forum can be, there may be people that are on the forum late at night when you're having those thoughts where you just want to share them with someone and get other people's ideas. So some people find that really beneficial as well, don't they?
Yeah, absolutely. It's a section that's for people who are in this position, waiting for results, waiting for a diagnosis, and it can be incredibly supportive. And we have a lot of community champions that also will come on, and try and respond, like you say, especially if somebody's perhaps not had a response or it's late at night, or just to reach out and let the person know that they're not alone with this. So it's definitely well worth checking out the forums as well. And if someone, supposing, Sally, somebody goes back for their results and it's confirmed that they do have a cancer diagnosis, obviously it very much depends on sort of the type and the stage and the grade and all sorts of different things, because we know that treatment is so tailored to an individual now. But what would you be saying in terms of how quickly treatment would usually start? I mean, often the first treatment is surgery, although chemotherapy is more often being used up front before surgeries. That's neoadjuvant chemotherapy. So what sort of timeframes are we looking at for people to start their first treatment?
Yeah, so there are NHS targets, and I know people have differing views about targets, but certainly those targets are aiming that it's helping teams to be able to deliver those treatments for people in a timely manner, so that people are prioritised within that system. Generally, across all of the nations, there is the target from when you have your first treatment. It should be 62 days starting your first treatment from the date of that referral from a GP, and that's across all of the nations. So people should start their first treatment within those 62 days. Within that, across some of the nations, there's also something called the 31-day decision to treat target, and what this means is that within for some people, they may need additional investigations, they may need additional tests. That should still all be done within that 62 days. But the 31-day decision to treat is when all the information is there and that you can sit down and have that joint decision making process with your team about what's the best first treatment. So they're kind of talking to you about, your results um, and then also listening to you and your experiences and the kind of person, so in that holistic way, so in that way that takes on board everything that someone's going through in life, and that you then make that joint decision about that treatment, then that treatment should be within 31 days of that decision. But again, it should be within also that kind of wider 62 days from referral. So this
Yeah.
is where roles such as the clinical nurse specialist, the breast clinical nurse specialist that everyone that's diagnosed should have access to, can be that point of contact for you, be your advocate. I see there's Sarah asking a question
Sarah,
about
yeah.
advocating for treatments. That really is the role of the clinical nurse specialist, to kind of advocate on the behalf of patients, and also keep you informed as to when your next investigation might be, how long the waits might be for that, and waiting for results, to try and kind of keep everything on track and keep you completely informed of that. And that's a joint process as well with the clinical nurse specialist and the patient. But that really is that role of advocating for the patient and support you through that pathway.
Yeah, and I'd strongly suggest, Sarah, if you want to give that helpline a ring, this is something we can go through with you in more detail.
Yeah.
Obviously, we're quite limited as to what we can cover in these sessions, but we could really, like, as one-to-one, go through with you. You can even leave a message tonight on the voicemail on the helpline number, and one of the nurses will give you a ring back tomorrow, so they can go through that with you in more detail. So yeah, we have had a couple of questions in, haven't we, Sally? So I don't know if you want to ask Louise's question, or I can.
Yeah, so Louise is asking, is there any harm in a delay in radiotherapy following surgery? So we get asked this one a
Okay.
lot, don't we, Jane?
Yeah. So radiotherapy is sometimes given after surgery. Depends on the type of surgery somebody's had. So it would usually be after a wide local excision, sometimes after a mastectomy. And there's kind of it's a subsequent treatment. It would usually be around about 4 to 6 weeks after surgery. Sometimes there are delays for different reasons. So there might be a delay in your wound. If your wound isn't healing sufficiently, it would be detrimental to give you radiotherapy to that area, because it would just break the wound down even more. So it's really important that if someone does have a wound, they will have a wound after their surgery, that has healed. Sometimes women can develop a seroma. So this is a fluid-filled sac that can develop it's just a build-up of fluid that can happen after any kind of surgery. And sometimes that can sort of distort the shape and the radiation field. So that might cause some delays. So some delays are necessary. If you're concerned about a lengthy delay, obviously there comes a point where there's a time frame within which you would need to give the radiotherapy. Otherwise, the treatment wouldn't be of any benefit. But your treatment team should know that. And if you've got any concerns about any sort of weights that you've got, it is about questioning your treatment team and asking them about that and the impact on your sort of diagnosis and outcomes. But yeah, wherever
Because Karen's
possible.
asking similar question, following therapeutic mammoplasty, waiting for radiotherapy. And again, it's, it is about asking kind of locally. So within your team, what are the weights? But I think two things. One, it's really important for people to, have that information before surgery around what to expect and the kind of things that might happen, so that you are as much as possible prepared about a wound and about, as you say, a seroma, a build-up of fluid, because sometimes that needs to be drained, and often breast care nurses will do that. Sometimes they can just be left. It really needs to be assessed clinically to make that decision. The other one is about, the arm exercises following breast surgery, because that gets your arm movement, you know, back to, preoperatively, or as optimal as it can be after your surgery, because it can be affected by the breast and the armpit part of the surgery. And to have radiotherapy, sometimes your arms have to be in a certain position. So it is being able to, have all the information to know that you're kind of prepared for next steps. Sometimes it is around, having seen what we call the surgical team, so the surgeon who does the operation, to then be referred to a different team, the oncologists, and they're the people that prescribe other treatments like radiotherapy and chemotherapy. So it's important about, when are you going to be seeing them and meeting them and making that decision, so that you can then ask them, when will the treatment be? So if you feel that you're kind of waiting for any of those things, again, the breast care nurse is a point of contact as your advocate to, help you with those timescales through the pathway. But yeah, people call us all the time, and we're happy to, again, help guide people, who's the best person to speak to, the kind of things to expect. And there's some great information on the website around kind of what to expect following surgery, and all that kind of physical impact, as well as all the kind of holistic emotional and life impact as well of a breast cancer diagnosis and treatments.
And the other thing that might help as well, if you're waiting for a specific surgical procedure, if you're waiting to start chemotherapy, we've got a service called Someone Like Me, so we could put you in touch with somebody who's been through that treatment, through that diagnosis, and they volunteer for us, and they're trained to support people that are going through that now. So obviously we know everyone's situation and experience is unique to them, but it can really to have that peer support for someone that's been through the treatment that you're waiting for, that's coming up, and for them to help you sort of find ways to get you through it. Really, it's that peer support. It can be so helpful and empowering, and often people do feel like it's that much more. If they've got more information, they feel more in control of the situation. They know what to expect up to a point, obviously. But yeah, we can put you in touch with somebody who's had different surgical procedures, different types of reconstructions, different chemotherapies and hormones therapies. This is for women with a primary breast cancer. We do have different services for women with a secondary breast cancer. So again, if people are with secondary breast cancers and waiting to start treatment, we've got a whole range of information on our website, and we do have dedicated services for people living with secondary breast cancer as well. So if you're in between treatments, perhaps if one treatment has stopped working and you're waiting to start another, we hope we're there for everybody who's affected by breast cancer. So again, it's not limited. None of what we do is limited to people with primary breast cancer.
No, and I think it's sometimes, I can imagine it's difficult to navigate through those kind of different supports, because everyone has their place. So obviously your treatment team, and whether that's in the NHS or the private sector, they're your kind of treatment team guiding you through that process. People, sometimes have friends and family that, support them through that process. And then, as you say, there are people, charities, such as ourselves and other organisations that are there to kind of run in parallel with your team to, to give you that information and support that you need. And then, as you quite rightly say, other elements can be that peer-to-peer support. So that's someone that has been through a similar experience or going through a similar experience. We talked about the forum, and as you said, there's Someone Like Me. All of that can have its place to to help people through what can be sometimes be quite challenging, and that information and support is vital.
Yeah, absolutely. And Sarah's asked a question, and I think this is where it comes into the, the uniqueness of somebody's individual situation. So Sarah says, hello, I was diagnosed with high-grade DCIS last year. I also have kidney cancer. I have not had a lumpectomy a year on due to difficulty in treatment. 2 metal clips migrated due to not being put in the right place. I feel like my breast surgeon doesn't care. I have been on letrozole for 10 weeks. I had to come off it due to crazy, horrible side effects. Yeah, I mean, obviously, Sarah, this sounds like a really difficult time for you. So DCIS is ductal carcinoma in situ, which is a form of very early pre-invasive breast cancer. So it's contained within the milk ducts, and there are low or high grades. And obviously the added complication of a kidney cancer. It does sound like you're having a really difficult time. We hear a lot about the difficult side effects of hormone therapy. So again, I'd really encourage you to give us a call if you wanted to talk this through further, or drop us an email so we can, see how we can support you. There are ways if you feel like, your breast surgeon doesn't care. I mean, that's really, sad to read that's how you're left feeling. But there is a resolution to this, and there is ways that we can help you perhaps find some answers, whether that's through your current team or through exploring the possibility of having a referral to a different team. It's very individual. Like I say, what we said earlier, it's very down to each person's diagnosis, other health conditions, general fitness levels, and all of these things. But it does sound like you're having a really tricky time for sure. So I would suggest you do get in touch with us so we can sort of help you a bit further with that.
Yeah, sometimes what we hear through the work that we do is people do feel kind of alone and isolated sometimes, and they wish they'd heard about us sooner, and so we're working really hard to reach as many people as possible. And I think what I'd say is, and people worry that maybe their question, or you don't have to have a question, you might just be having a day where you're just finding it difficult to kind of navigate through everything you're going through, and you just want to talk it through with someone. That's okay as well. I think it is just that, don't, where possible, don't suffer in silence, and no questions are silly question, or no comments. We're happy to be asked anything, and if we don't directly know the answer, we know someone that does, and we can get back to people. And I think people can see that their NHS teams are really busy and they don't want to bother them. And what I say is, at the end of the day, we're all here for you. We're all here for anyone affected by breast cancer. And so, everyone's question or concern is just as important as someone else's. And, do feel free to kind of ask it, or, contact your team to ask them any questions, and feel like you need some support because you want to know, waiting and what's going on. I think try not to be afraid to ask that. I know it's in some cases easier said than done, but as you say, we often talk people through on the helpline to help navigate them through that process and who it might be best for them to speak to. But there is support out there for people.
Yeah, absolutely. And it's about sort of working out what for you as an individual works. Like you say, family and friends are tremendous support, and that is one form of support. Ourselves and all our services, we have a whole range of what we call speakers lives, so videos where there's an expert speaker you can register for a talk on different subjects. So it might be that some people just want to gather as much information as possible. Some people say, I don't want to know anything, just tell me when I've got to turn up at the hospital and I'll turn up. And absolutely anything is whatever's right for the individual. Some people want to know absolutely everything and anything, and some people, like I say, are just tell me when to turn up and where and I'll be there. But if you are somebody that finds it helpful to have the information, then our website's brilliant for the health information. A lot of our information is available in booklet form that you can order, so you can have a hard copy. Like I said, the various services that we offer on the speakers' lives and things like these Facebook lives hopefully are helpful as well to help people feel just more well informed and have more of an idea as to what to expect.
Yeah, and I think, the breast, a pathway for someone that is diagnosed with breast cancer, it can be that, that assessment when you're first seen and those biopsy results, give enough information to move on to the next step, to make some decisions, as you say, about treatment. And for some, for most people, surgery is the first step. But as you say, there are some people that have chemotherapy, but sometimes those treatments then can determine what's going to happen in the next step. So surgery, if someone has a lumpectomy or a wide local excision, an area of the breast tissue removed, and most people having surgery will have lymph node surgery, whether that's a sentinel lymph node
Mm,
biopsy to kind of test the lymph nodes, or if there's any suggestion there's any changes, they might have, the lymph nodes removed. You then get the information from the operation after the operation. So sometimes it can be quite challenging not having all the information up front, and it can
mm,
come, in those steps through your treatment. And for example, if you're having chemotherapy first, it's about, waiting to see how, the lump has responded to the treatment in terms of the next step. So,
mm,
we completely acknowledge it's that information, those needs, and the information you get can change during that time. And so we hope that we kind of offer information across all of
mm.
those areas, but we also, acknowledge that that can sometimes be overwhelming. And that's why people like us or like your team can really help you kind of navigate towards what information and support might be really specific to you. But as you
Mm,
quite rightly say, Jane, everyone's information needs are different and individualized to them, and it is about meeting
mm.
people's needs, whatever they are. And as you
Yeah.
say, some people want lots of information and research trials, and then other people, as you say, just enough information to give informed consent and, tell me where
Yeah.
to go and when. And neither of those are right or wrong.
No.
Everyone's somewhere in between. It just is personal. It's like anything in life. It's really personal to you.
Yeah, and it's also looking at other sort of self-help techniques to help with managing sort of anxiety and uncertainty. So we have got information. The information around coping emotionally on the website is more geared for people who do have a diagnosis, but there's lots of information available. The NHS have got great information about managing anxiety. Every Mind Matters is one website. Mind. The organisation Mind has, really good information about managing anxiety generally. There's lots of information. There's apps available, different things, breathing techniques, relaxation apps, counselling, some forms of cognitive behavioural therapy to help people with managing that way. If you're not going to get the answer, you need the answer, that's what's going to help, but you're not going to get the answer for a couple of weeks. It's right, how do I manage this way so I'm not spiraling, I'm not catastrophizing. It's about, yeah, these are the techniques that can help someone feel just a little bit calmer and a bit more in control. And speak to your GP if you can, if you do feel it's something that you're struggling with, and your treatment team if you can as well. If you're struggling with, there might be sort of in hospital internal psychological support therapies. There might be sort of wellbeing centres attached to your local hospital, and it's somewhere where you can access the sort of the skills, or some of the skills and techniques to help somebody perhaps feel a little bit more grounded and less, like I say, that sensation of spiraling and everything feels like it's going out of control. It's really an unpleasant feeling, and people have unpleasant thoughts and dark thoughts, which again can happen, and that's not unusual at all.
Yeah,
Um,
I mean, Sylvia's just mentioned, feeling concerned about, her neck having another cycle of chemotherapy because some of the side effects she's finding are really, like peripheral neuropathy, quite
mm,
disabling. And I think that really is about, you can give us a call and we can talk to you about that, but also your kind of chemotherapy team, before another cycle, having a discussion with them about how you're feeling and the side effects, and how you feel about the next cycle, because there might be things that they can put in place, and decisions they can make with you around your treatment. So I think if you can just really voice those concerns with your team. And I think Claire has said things such as not feeling mentally prepared for other treatments, and I don't think I'll ever, and some people not thinking they're ever going to be prepared. And we completely acknowledge that can be, those feelings of fear and not being prepared must be really, really difficult. I guess, Claire, it's about talking those through, and sometimes being able to verbalize those fears, finding out what's the worst for you. Are there things that people can kind of do and support you through those? So I would say again, do give us a call or an email, and also discuss that with your treatment team, because
mm,
yeah, we can only imagine that is hard.
Yeah, and I suppose it might help just to sort of kind of, as we come towards the end of this session, is think about if people really are concerned about sort of waiting times. That's something we've not really touched on. Is if they do think that there's an issue, obviously it's raising it with your own treatment team in the initial. Initially, and if you don't feel like you're getting any resolution to your concerns, then there are processes in place for raising an issue, raising a concern, and waiting times. If you're concerned about a waiting time, or how long you've waited for a treatment or for an appointment, you can raise that through things like the PALS service, the Patient Advice and Liaison Service in England, the Patient Advice and Support Service in Scotland, in Wales, Northern Ireland. They have different systems in place, but we can certainly put all those in the chat for, you know, how you can raise those concerns as well. I mean, hopefully you won't need to if you get the information from your treatment team. If they can explain, often that's what's missing. It's perhaps the explanation as to why
Yeah,
there's a
why?
wait, or
Yeah,
and if you're told that and you know that, then well, okay, I can deal with that. But often it's if that's missing, then that's what can be hard. But there are things that you can do to raise a concern about a wait. But yeah, for anybody this evening who's ask questions, or anybody that's not asked questions and they want to, you know, get in touch with us, please do give our helpline a ring. Like I say, we're open at 9 o'clock tomorrow morning, or you can call us this evening and leave a message, and one of the nurses will give you a call back. Next week we have our usual Thursday evening Q&A with colleagues Louise and Cassie. Is there anything else you wanted to add, Sally, before we drew to a close?
no, I think I think I would just reinforce that, there is support here, and if you are that waiting time for kind of any treatments, biopsies, any part of that process, do please contact us or your treatment team, as you say, to try and find out why, and be aware of what's going on, because that can sometimes make a difference. So yeah, I think it's just that there is support there, hopefully, for people. Yeah,
absolutely. Okay then, well, thanks everybody. Enjoy the rest of your evening, and like I say, don't forget to put in any suggestions you have for future chats, future Facebook sessions. They'll often be with nurses like myself and Sally, but we also have sort of guest speakers on experts on a variety of different subjects. So we can get sort of more specific sort of themed sessions as well. So yeah, any suggestions you've got, please do pop them in the link that we've sent, what we're posting up.